I chose gynecology by choice, not by my father or my grandfather. They were legends. I'm not a reserved person, I'm a private person.
What is success for you, Dr. Garu?
I should be happy with myself.
పర్ఫెక్ట్. డాక్టర్ గారు మీ కాలేజ్ డేస్ గురించి చెప్పండి డాక్టర్ గారు.
I was an average student.
మీరు అసలు అల్లరి చేసేవారు కాదు డాక్టర్ గారు కాలేజ్లో కానీ?
క్లాస్కి వెళ్ళేవాను కాదు.
డూ యూ యూస్ టు స్పెండ్ యువర్ టైమ్ ఇన్ లైబ్రరీ?
No, I used to roam.
మరి ఎలా? హౌ డిడ్ యూ పాస్?
Like, I can read in the same textbook కదా.
So, this makes me conclude on one point. Not all average students are perform badly in their life.
The answer is yes.
ఒక మంచి డాక్టర్ దగ్గరికి వెళ్తున్నామో లేదో అనే భయంతో చాట్ జీపీటీని కూడా ఆశ్రయించేస్తున్నారు.
But in the process it became evil.
ఇన్నిట్లో మీకు ఎలా ఆ నాలెడ్జ్? ఈజ్ ఇట్ బికాస్ ఆఫ్ రీసెర్చ్?
Destiny.
You apply your research bent of mind into films also.
One thing I would advise to anybody is never do business with a friend.
డాక్టర్ గారు, అంటే మీరు రీప్రొడక్టివ్ మెడిసిన్, మేల్ డాక్టర్స్ యాజ్ ఎ మ్యాన్, రీప్రొడక్టివ్ మెడిసిన్, గైనకాలజీ, ఐవీఎఫ్, ఇది మీరు చూస్ చేసుకుంటున్నప్పుడు, ఎంబీబీఎస్ అయిన తర్వాత ఇది ఈ స్పెషలైజేషన్ చూస్ చేసుకుంటున్నప్పుడు మీకు రెసిస్టెన్స్ ఏమైనా వచ్చిందా?
Two things. My father said, don't expect my practice to come to you. If you love the subject, choose it. I opted for gynecology and obstetrics because it involves medicine, surgery, and two sets of people, the mother and the child. It's a multi-dimensional facet of field that brought my curiosity. All other fields, it's a single organ.
నేను ఒక పెడియాట్రిషియన్తో మాట్లాడుతున్నప్పుడు ఎందుకు అది చూస్ చేసుకున్నారని అడిగినప్పుడు లైఫ్, ఐ సీ లైఫ్ అని అన్నారు. సో అలా మీకు ఇది చూస్ చేసుకుంటున్నప్పుడు మీరు అన్నారు కదా మల్టీ డైమెన్షనల్ మదర్ చైల్డ్ అని, ఇలా లైఫ్ అని అలాంటి ఇది ఉందా? బికాస్ గైనకాలజీ యూ గివ్ లైఫ్, న్యూ లైఫ్.
No. I feel it's a puzzle. And there is so much of unsolved problems and riddles which we are ignorant about. And there's a lot to uncover and also a lot to learn. So the field is vast. The discovered field is vast, leave alone the undiscovered field. So I'm curious. So I had a huge field to explore.
డాక్టర్ గారు మీ కాలేజ్ డేస్ గురించి చెప్పండి డాక్టర్ గారు.
I was an average student.
ఎప్పుడు వరకు?
Right throughout. I took 3 attempts to enter medicine.
ఓకే, ఆఫ్టర్ యువర్ 12th.
Even when in Manipal, when my parents paid the donation, they said I'm ineligible, that this candidate will not pass, so we won't give the admission.
కాలేజ్ వాళ్ళు?
College well. So in the 3rd attempt, I got my I got a 140th rank. I entered Andhra Medical College, and we are the 3rd generation from Andhra Medical College. My grandfather is the first batch student of this medical college, 1923. My father in 1948. I am the 3rd generation in the same medical college, and all of them took the branch of gynecology. My grandfather may not be a gynecology specialist, but he was also had a considerable delivery practice.
సో వాళ్ళ ఇంపాక్ట్ మీ మీద ఉందా డాక్టర్ గారు?
Pressure on them.
ప్రెషర్ ఉంది అంటే వాళ్ళ
They were legends.
లెజెండ్స్. ఆ లెజెండ్ అది రీచ్ అవ్వాలనే ప్రెషర్ మీకు మీరుగా పెట్టుకున్న ప్రెషర్.
సోషల్ ప్రెషర్.
సోషల్ ప్రెషర్.
Social pressure makes you sometimes an introvert or sometimes a rebel.
ఎల్స్ ఆ సోషల్ ప్రెషర్ లేకపోయి ఉండుంటే మీరేం చూస్ చేసుకునేవారు?
I mean, still I would choose gynecology. I choose gynecology by choice, not by my father or my grandfather. And I only in medicine you have to give choices. I only gave only one choice, gynecology and nothing else.
మీరు యావరేజ్ స్టూడెంట్ అన్నారు కదా డాక్టర్ గారు, అక్కడి నుంచి ఎలా ఈవేళ ఇంత రీసెర్చ్, ఇంత నాలెడ్జ్,
అంటే
హౌ డిడ్ యూ ఎక్వైర్ ఇది?
యావరేజ్ స్టూడెంట్ యాజ్ పర్ కన్వెన్షనల్ నార్మ్స్. Our training system defines a set of problems of answering a set of questions. If you think out of the box or you question the system, you are out of the system.
So, this makes me conclude on one point, not all average students are perform badly in their life.
The answer is yes, because what happens is our assessment system is based on memory recall and a set of skill sets which are defined, and only those skill sets are tested, not the broader understanding of the philosophy of medicine. And if you perform that, you perform. If you are a parrot, you perform.
Your mark score will be high.
High.
You can say I'm అక్కడ యావరేజ్ నుంచి డాక్టర్ గారు మీరేమైనా గోల్డ్ మెడల్స్ అలా వచ్చారు?
No, nothing. I didn't fail anywhere. Because మెడిసిన్లో ఏమవుతుందంటే we were 125 students. Many people fail, but failure can happen for many reasons. Out of the 125, no, not even failing one subject, only around 35 were there. I am one of the 35. Then the second thing is, I didn't get the conventional medical entrance examination, so I took the national board. In the conventional thing, you do your MD. I didn't get selected. So I took the national board, which is equivalent to that. And their national board at that time was much tougher than MD. MD entry is difficult, exit is easy. In national board, entry is easy, exit is difficult. Because in a national board, the papers are now set at the national level. The examiners are from the national level in an unknown area of center. Whereas in an MD, the entry is difficult. But the exit is your
Easy.
own teacher. He is one of the examiner. And her set of friends or colleagues are the co-examiners. So sometimes they lend a helping hand
to bring you out of this stream.
Whereas in a national board, the examiner and the examinee are strangers.
So, make me understand as a lay person, మీరు MD నేషనల్ బోర్డ్లో తీసుకున్నారు. అండ్ ఐవీఎఫ్లోకి ఎలా వచ్చారు డాక్టర్ గారు?
IVF, my experience in Germany, I had a mentor at Tiniberg, and I had also a Russian colleague who helped me to get the exposure of IVF. And I went to Germany to learn endoscopy, and Germany was a place where endoscopy was founded. And I had a short stint of training with one of the early pioneers in the world who did the first appendectomy in the world. So it's at Kiel in Germany. And there they also had an IVF unit. But I returned every year for 10 years. So that constant every year going back and learning is not a conventional way of learning, but an incremental learning, where I was able to afford my own travel and go back and learn. That made a huge difference. Conventionally, what people do is they do a course, come back. But sometimes that opportunity may not be there because of language barrier or national barriers. So I opted which is practical. Go back every year for 10 to 15 years. And finally at a certain point I became a visiting professor there. At Kiel University and at Kiel Gießen University.
ఒక మంచి డాక్టర్ దగ్గరికి వెళ్తున్నామో లేదో అనే భయంతో చాట్ జీపీటీని కూడా ఆశ్రయించేస్తున్నారు. వాట్ ఆర్ యువర్ కామెంట్స్ డాక్టర్ గారు? అంటే అది తప్పే, కానీ ఈజ్ ఇట్ బికాస్ ఆఫ్ ది ఫియర్ దట్ మెడికల్ ప్రొఫెషన్ హ్యాస్ క్రియేటెడ్ ఇన్ ది మైండ్స్ ఆఫ్ ఎ కామన్ మ్యాన్?
It's partly two things. Google in the beginning said don't be evil. But in the process it became evil. And in the process search engine is manipulated by the system and by the advertisements. Whereas at this moment a new kid on the block has idealistic things, but with time the idealism might go. So at this moment ChatGPT is telling us from where it is picking the references and giving answers. But hopefully it will stay like that.
ChatGPT health అని కూడా వచ్చిందంట, సో ఓన్లీ హెల్త్ రిలేటెడ్ ఇస్తుందంట.
అంటే here what happens is the art of presenting knowledge on the web is changing by the LLM models.
డాక్టర్ గారు 96లో ఫస్ట్ టెస్ట్ ట్యూబ్ బేబీస్ మీరు డెలివర్ చేశారు. అక్కడి నుంచి ఇప్పటి వరకు ఈ 3 decades ఆఫ్ జర్నీలో మీకు చాలా గుర్తుండిపోయే ఒక మూమెంట్ చెప్పండి. చాలా ఉంటాయి, but one thing which you can immediately recollect other than the one that beginning 1996 test tube babies?
And actually what happens is in the beginning you realize you're solving a problem, but as you become more knowledgeable it's not so simple. It carries more responsibility, more precautions to prevent and reduce and improve the health of the unborn child. And that is missing.
Do you want to fill that gap, Dr. Garu?
That's already I'm doing it for the last 10 years. But the sad thing is patients perceive as waste of time.
So how do you want to educate your...
I can't educate. I'm already doing something which is useful for them, for their unborn child. And they're in a hurry.
Patient is in a hurry. The visitor is in a hurry.
And second thing is they don't understand the value of good quality documentation and they don't bother to read it. Sometimes even medical doctors don't read their own notes which I give them.
మీకు ఇష్టమైన రైటర్స్ కానీ లేకపోతే ఇష్టమైన బుక్స్ కానీ ఏంటి చెప్పండి.
I did everything.
ఎవ్రీథింగ్.
All genre.
ఫిక్షన్.
Everything.
హూ ఈజ్ యువర్ ఫేవరెట్ రైటర్ ఇన్ ఫిక్షన్?
Basically, in school it is Enid Blyton and Amar Chitrakaras.
Oh.
Pi was the creator.
Pi, yes,
at that
yes.
time. All were written by Pi.
Pi, yes.
In school. And then college not much. And then I prefer more non-fiction, information related or knowledge related, not motivational related. So sometimes I read the motivations also, or motivations packed as a story.
మిమ్మల్ని మీరు ఎలా డిస్క్రైబ్ చేసుకుంటారు? అంటే ఈజ్ ఇట్ యువర్, డూ యూ ఫాలో యువర్ ఓన్ సోల్ కాలింగ్, ఆర్ డూ యూ గెట్ ఇన్ఫ్లుయెన్స్డ్ బై ఫ్యామిలీ ఆర్ పియర్ ప్రెషర్ ఆర్ సొసైటీ ఆర్ ఫ్రెండ్స్? సో హౌ డూ యూ డిస్క్రైబ్ యువర్ సెల్ఫ్ in 1 or 2 sentences?
In the initial years, the successful people, but what happens is each successful person, those rules apply in that particular century and what set of situations. And without knowledge, no success comes in. There are no shortcuts for a consistent basis. And second thing is, we should define what is success. Is it fame? Is it applauded by the contemporaries?
Is it knowledge?
Knowledge, or your peace, your inner peace?
Okay.
Nobody has a perfect definition. Each group of people have their own definition.
What is success for you, Dr. Garu?
I should be happy with myself.
Perfect.
And I should not have regret.
So, you want to do whatever you want to do?
The answer is, as long as it's ethical.
Yes. Dr. Garu, IVF, మీరు 1996లో టెస్ట్ ట్యూబ్ బేబీకి ఆ ప్రొసీడియర్ చేశారు. అప్పటి నుంచి ఇప్పటికి ఈ జర్నీలో ఇప్పుడు మష్రూమ్స్ అయిపోయాయి, స్ట్రీట్కి ఒకటి. ఇంతకు ముందు కూడా మనం మాట్లాడాం, కానీ దీని గురించి మీరు మీ ఒపీనియన్ ఏంటి డాక్టర్ గారు?
There are two things. The demand is there, the supply is there. The expectations of the people of the demand are sky high. Not accepting IVF gives at the most on a consistent basis 30% carry home baby rate. I am not speaking about pregnancy rate. That means you need more than one attempt. That acceptance is not there.
So they want it in first attempt itself. Because they are going to a doctor.
Doctor, you are bringing a new life which is going to be there for 50 years. What is the definition of success of IVF? Is it the creation of embryo, or healthy baby, or healthy human being? That's what US is actually at the current period. Alabama court is struggling to find out when is life, the point of life.
మంచి పాయింట్ చెప్పారు.
The second thing is, the providers are getting confused between reproductive medicine and IVF. Infertility involves reproductive medicine. In that, a small segment is IVF. But at this moment, it got inverted. IVF became the mainstay of infertility treatment. And with that, the entry of venture capitalists has changed the whole ecosystem of a business model. In a business model, without stringent regulations and stringent quality control of the input system, then the system gets cracked and sometimes gets rotten.
డాక్టర్ గారు ఈ జర్నీలో మీకు ఎదురైన వర్స్ట్ ఎక్స్పీరియన్స్ ఒకటి చెప్పండి డాక్టర్ గారు.
The first thing is being sued for doing a normal delivery.
God.
And it took me from lower court to high court to Supreme Court to win it. I lost in the district court. The papers publish it. But when you win in high court, nobody publishes it. When you win in Supreme Court, nobody publishes it.
You want to talk about that, Dr. Garu?
It's over, isn't it?
It's over.
So that is for doing a vaginal delivery.
Which is normal.
Which is normal. And I say negligence is different from a complication. When you're doing something, you can cut your finger. It's a complication. That's not negligence.
Yes.
But if a child cuts it, it's negligence. Or the parents to give the knife. People do not understand sometimes the difference between a complication and a negligence.
ఒక ఐవీఎఫ్ కోసం మీ దగ్గరికి వచ్చే ఒక కపుల్కి వాట్ విల్ బి యువర్ ఫస్ట్ మెసేజ్? రాబోయే వాళ్ళు కానీ లేకపోతే వచ్చిన వాళ్ళకి కానీ వాట్ ఈస్ ఇట్ దట్ యూ వాంట్ టు టెల్ టు దెమ్?
The first thing is, I try to look at all the role reports. Sometimes they're 10 pages, sometimes they're 300 pages. And try to analyze what is the problem. After I understand the problem, then I ask them, do you know your problem? If the problem is already evident there, I explain this is your problem. A lot of times they're surprised to know their own problem.
తెలీదు. Nobody reveals that to them.
Either they did not understand, or they did not document it, or it was not told. All three possibilities can be there. The couple did not understand, or the doctor did not document it properly in a legible, understandable way, or did not tell. All three possibilities can be there. Just saying unexplained infertility or unexplained IVF failure is not the answer. Most of the time we have problems which are evident in the data. The second thing is, we do not have patience of doing an analysis of data and mapping the points, because reproduction is a multifaceted thing. Age can make a difference, obesity can make a difference, smoking can make a difference, lifestyle makes a difference, family history can make a difference, work conditions make a difference. Unless you map those points, how can you come to a diagnosis?
సో మీరు అసలు అల్లరి చేసేవారు కదా డాక్టర్ గారు కాలేజ్లో కానీ?
క్లాస్కి వెళ్ళి కదా.
లైక్ జగ్గి వాస్ దేవ్
క్లాస్కి వెళ్ళేవాను కదంటే బేసిక్లీ యూఆర్ టెల్లింగ్ ఫ్రమ్ ద టెక్స్ట్ బుక్ అండ్ ఐఎమ్ రీడింగ్ ఫ్రమ్ ద సేమ్ టెక్స్ట్ బుక్. వాట్స్ ద డిఫరెన్స్?
సో హౌ డిడ్ యూ కోప్?
No, I said, there are two things. Bedside learning is different. Theory class are different. My personal feeling, which I can might differ with the current conventional system of attendance system. Why are you making the student sit in the class ideally when he doesn't want to sit in the class?
మరి మీరు వెళ్ళకపోతే అటెండెన్స్
అదే నా ప్రకారం ద గోల్ ఈజ్ bedside learning is different. There are two components in medicine. Bedside learning. If you don't go, then you won't learn.
Hmm.
The theory classes is somebody, you and the teacher is reading the same book and you're able to understand what's the purpose of listening there.
So, do you used to spend your time in library?
No, I used to roam.
But Ella, how did you pass?
Like, I can read in the same textbook. Kada.
But you have joined the board, right?
This is in undergraduation.
Okay, okay.
I said I'm an average student. I said I never performed well. I passed with the decent marks, but not the outstanding student.
So, a ranker need not always be successful in his profession.
And a failed person
need not fail in his profession.
And in the failure system, sports law, when you are training that person, why are we not using it for humans? That's a pity.
Yes. డాక్టర్ గారు మీరు సినిమాలు చూస్తారా?
ఆన్ అండ్ ఆఫ్.
ఆన్ చూస్తారు. మీకు ఫేవరెట్స్ ఎవరైనా ఉన్నారా? జస్ట్ అలా చూస్తారు. హౌ డు యూ చూస్ టు వాచ్ ఎ మూవీ?
By the most of the time, I must have finished reading that novel.
Okay. Okay.
And second thing is, after my association with Sunil Kumar Reddy, I and I asked him for a book on cinematography. I look at how the shot is taken. So rather than enjoying the story, I look at the art of making the film.
Okay.
And then look at.
So you apply your research bent of mind into films also. So do you look into this story also, how he has woven this story?
Because what happens is, most of the famous books or English movies, already the books are already written. I must have finished reading that book.
Okay, then you watch that and correspond to the art of filmmaking.
Art of filmmaking, but I don't see in many films because I'm restless of that 3 hours.
I understand. నా 3 hours waste అయిపోయింది, నా 3 hours waste అయిపోయింది.
And 3 hours అయిపోయిందంటే like the first 1 hour I can look at from the cinematographic angle, the music angle, then my job is over.
Once you get the pulse, okay, this will be the tone of the movie. మీ బెస్ట్ ఫ్రెండ్స్ ఎవరైనా ఉన్నారా డాక్టర్ గారు, ఆర్ యూ హ్యావ్ జనరల్ ఫ్రెండ్స్?
I have a few good friends, and they do anything for me.
So they will walk up to you till end of the earth.
Yes.
అంతే కదా.
But one thing I would advise to anybody is never do business with a friend.
ఎందుకని? దిస్ ఇస్ సౌండింగ్ స్ట్రేంజ్.
You're doing a business with a friend because of the trust factor. A friend is a person who looks at all facets of you and accepts you as a person. Whereas an acquaintance only looks at the good facets and accepts you. Then second thing is, when you're doing a business with friends, you're doing it with your selfishness of protection and afraid of cheating. But as you grow, he may not grow at the same speed you are growing.
Friend.
And
you cannot say anything. అలా అంటారా?
And then your priority is your friend important or your organization important?
Organization.
Then you are firing a friend.
Your friendship breaks.
Yes.
ఈ లాజిక్ అందరికీ ఎందుకు అర్థం అవుతుంది డాక్టర్ గారు? మీరు ఎక్స్పీరియన్స్తో చెప్తున్నారా ఇది?
ఎస్.
ఓకే. మీరు ఎప్పుడూ యావరేజ్ స్టూడెంట్ అన్నారు. ఇప్పుడు చూస్తే గవర్నమెంట్ విద్వాన్ పోర్టల్లో మీ ర్యాంకింగ్ 10 on 10, ఫ్రమ్ యావరేజ్ టు 10 on 10. ఎలా ఇది సాధ్యమైంది? గ్రాఫ్ ఇలా వెళ్ళినట్టే కదా.
అంటే I study 20 hours each week.
ఇప్పటికి.
Then 30 years, the difference becomes huge.
And you submit, you just don't keep that knowledge to yourself, you do research. You submit papers,
And
you write books.
I also interact with cross-functional people.
Mm.
So it gives me different perspective of life. So sometimes I bring that knowledge to use that interpretation. I use it to technical tricks. It was discovered by a Russian scientist for problem solving. I use mind map to simplify the clutter and declutter the information into understandable piece of chunks of information.
ఇది maybe going forward we will ask you ఎలా అని.
Because my
That
mind
might help
map
others.
I'm doing since 2000.
అంటే 26 years.
Tony Buzan.
Do you believe in soul?
Yes.
So soul is there.
Soul is there, heart is there. Heart and soul are different. Mind and soul are different.
చాలా మంది అడుగుతూ ఉంటారు సోల్ కనిపించదు కదా అని.
కనపడట్లేదండి. But there are two voices speaking. One is your mind and one is your soul.
Soul is invisible, is that?
Even mind is invisible. Brain is not mind.
Yes. Brain is a part.
Somebody said brain is a mind, so we are accepting it as that.
Yes. Is soul a subtle form which lies inside everybody?
Everybody has a soul. Everybody has a mind. And if you want to know the difference between soul and a mind, should I do it or should I not do it? That means the mind and the soul are speaking to each other.
Every soul searches for a body to enter.
I know that concept, but I don't have clarity of that concept.
Maybe you made this statement out of your soul.
Yes.
అంతే కదా డాక్టర్ గారు.
Because what happens is, at a philosophical level, my knowledge is not adequate to give a clear explanation for that. My knowledge is very, very superficial.
It's not about explanation, it's about your voice, your feeling.
And the philosophy people are there able to clearly tell that. My knowledge is not adequate to clearly explain that.
But you believe in that.
Yes, without any doubt.
Thank you, Dr. Garu. Thank you for this diverse conversation.